Hello, my name is Teresa Lee, and today I'm presenting a case for JD, a 33-year-old male who presents with a new mass on his left thigh. Chief complaint, he states, quote, a large mass on my left thigh that I noticed today. And this was 2 days ago that I saw the patient. So the patient first reported noticing the mass morning of presenting to the clinic. 2 days prior, while performing some squats at the gym, he felt pain in his left thigh, which was more intense than usual. However, the pain has since resolved, and he denies any ongoing tenderness or discomfort in the area. The mass is described as non-tender, it's non-erythematous, and boggy to palpation. He denies any fever, chills, changes in skin color, recent trauma, or bruising. The mass has not changed in size since its discovery. He doesn't have any significant medical history, surgeries, or hospitalizations. He's not currently on any medications. And he currently works as an office manager and is active in weightlifting. He denies any tobacco, alcohol, or drug use and lives alone. Through the review of systems, the patient denies any symptoms like fever or fatigue. He denies any cardiovascular, respiratory, GI, or neuro concerns. His musculoskeletal exam is notable for the mass on his left thigh, but he denies any weakness or sensory changes in the affected extremity. The integumentary, hematologic, and lymphatic systems are unremarkable. For his physical exam, his vital signs are stable and within normal limits. The patient appears well nourished and in no acute distress. On musculoskeletal exam, there is a large, deep mass on the lateral anterior left quad, approximately 6 centimeters in diameter. The mass is boggy to palpation, non-tender, and non-mobile. There is no erythema or warmth, and full range of motion is preserved in the hip and the knee. Neurologically, strength and sensation are intact, and there are no signs of lymphadenopathy or vascular compromise, and the rest of his physical exam was unremarkable. Differential diagnoses, the very first one is strain of the left quad muscle, fascia, or tendon. The recent history of squats and the location of the mass make a muscle strain very likely, which is resulting in localized swelling or fluid collection. The next is contusion of the left thigh. A soft tissue contusion may cause a mass. The absence of any tenderness or bruising or redness makes this diagnosis less likely. The last differential that I had was liposarcoma, which is a malignant tumor of the adipose tissue that could present that as a non-tender mobile mass. The depth of the mass and its consistency raise concern, but is unlikely in a healthy young individual, although it does remain a consideration. And the most likely diagnosis is a strain of the left quad muscle, fascia, and tendon, considering the patient's recent physical activity and the absence of signs of infection or malignancy. However, liposarcoma remains a differential given the persistence and boggy consistency of the mass, and further imaging is warranted to rule out malignancy. So my plan, we started with an ultrasound that was ordered that day to assess its internal structure and rule out a hematoma, abscess, or other soft tissue abnormality. Depending on the ultrasound result, if it shows a simple fluid collection that suggests a hematoma or a muscle contusion, it can be treated conservatively. If the mass appears more complex or solid, further imaging like an MRI or a biopsy will be needed to rule out malignancies. For treatment, I prescribed the patient ibuprofen 600 milligrams every 6 to 8 hours as needed for pain management and inflammation. He was also educated to apply cold compresses to the area for the next 48 hours to reduce swelling, and then resting and avoiding heavy lifting or squats until further evaluation is done. Education-wise, the patient was educated on possible causes of the mass, including hematoma and muscle contusion, and instructed to monitor for any changes in size, pain, or signs of infection. He was also informed about the possibility of malignancy and the need for further evaluation if the mass persists or changes. And then follow-up, we did schedule a follow-up for 1 week for reevaluation. If the mass worsens or new symptoms like redness, warmth, or pain develop, the patient was instructed to contact the clinic or go to the ER. If signs of malignancy appear, such as rapid growth or a fixed firm mass, develops, further diagnostic testing will be promptly initiated. So to summarize, JD presents with likely a muscle strain leading to a soft tissue mass. However, we are waiting on ultrasound results to confirm the diagnosis, and further imaging is needed to rule out malignancy if the mass persists or shows concerning features. And that is it. If anybody has any questions, feel free. I would love all of your input. Thank you.